Good afternoon, everyone. So I'll be talking on this topic, Mobiret cam. So use of smartphone for capturing fundus images has not been a new thing. It's been done for quite a time right now. And the technique has evolved from the traditional holding a smartphone in one hand and the 20 diopter in another hand to the use of adapters, whether handheld or whether slit lamp mount adapters. But the principle of working in all them is the same. It's based on a standard indirect ophthalmoscopy, where the phone's flashlight and the camera they act as a coaxial light source, and the image is formed between the 20 diopter lens and the phone's camera, and then it is captured. So the traditional smartphone ophthalmoscopy, it included the holding a phone in the right hand and a 20 diopter in the left hand. As you can make out, the patient in this is not that much comfortable. So we published in Journal of Visual Sciences about the traditional method, and these were the quality of images which we were getting at that time. As you can make out, the images are decentered, defocused, and not at all giving a good idea about the pathologies. So the main reason of this decentration was the instability of the system. Since the entire system is handheld and it's in the air, floating, and the distance between the phone and the 20 diopter lens should be maintained approximately 15 centimeters. So this led to the entire instability of the system and had a long learning curve because of this. So then we came across a blog by Dr. Biju Raju, who emphasized the connecting a pipe between the phone and the 20 diopter lens. And at the end of this blog, we came across this adapter. But even after doing so, as you can make out in this video, the entire system and the entire imaging keeps defocusing from time to time. Then we came across an idea of mounting the entire assembly line onto a common hole which is present in all the slit lamps in the common axis with using this adapter. With this adapter, after examining the well-dilated patient, we move the two arms apart, we take the instrument, mount it on the common hole, and after that tell the patient to see in the straight. And with the help of the joystick we can make minor adjustments and focusing. After that a camera is switched on, and on always flashlight on, video mode is switched on. In this patient you can make out there is a cataract in this patient with the NS grade 1 to 2, and even after doing that, even after the cataract, the image is properly focused and well centered. So the advantages of this adapter is it's a universal mobile adapter and it can be placed on all the slit lamps. It can be converted to a handheld device as well for peripheral screening purposes. It has no learning curve at all. Anybody, even the paramedics, can use this device, and its images which is captured can be used for teleophthalmological purposes. This is a rough comparison. As you can make out in this video, this is the handheld method as compared to the slit lamp mount device. The slit lamp mount devices are much more stable and have a proper centration and focusing. Coming to the image editing, in all the images there will be two light reflections will be present, which will be of the 20 diopter lens. So those can be removed with the help of this Adobe Photoshop Express software. With just a click of a button which is present in the lower right hand side here, you can remove these two reflections. These are the few retinal pathologies which we have captured over the time. Papillary edema, the optic disc pit, CRAO, peripheral retinal degenerations, RP, degenerations, vein occlusion, CRVO, choroidal detachment, old RD. Even the peripheral part can be captured by telling the patient to look above and downwards with the help of a slit lamp marker. Thank you. I would like to thank Dr. Zain, Dr. John and Dr. Biju Raju for helping me out with this instrument.
This can be applied to any slit lamp.
Yes, sir.
Where do you get these adapters?
So right now, I think it will be available in one of the stalls. In maybe Epsilon people are.
How much does it cost?
It's costing around 10,000, sir. Thank you.
Did you try to compare this with the current retinal cameras that we have? These so expensive ones, the Zeiss one and all those. I mean, does it compare with them? Is it superior to them? Not only in terms of cost, also in terms of your facility and the images.
Not we've not compared it directly, but in future we plan to do that, ma'am.
Okay.